Welcome to this podcast consisting of unknown cases with a high didactic value. Let us examine case 1 and 2. Dermoscopic image A is a lesion on the abdomen of a 69-year-old female. Dermoscopic image B is a lesion on the shoulder of a 61-year-old male. What is your diagnosis for these two lesions? Lesion A has what appears to be an ovoid nest and arborizing vessels. Lesion B has a similar dermoscopic morphology. Based on the primary dermoscopic morphology, both lesions could be basal cell carcinomas. It is clear that the final diagnosis rests on more than just the dermoscopic primary morphology of the lesion in question. Other factors such as patient history and differential recognition are also important factors used in rendering an accurate diagnosis. Patient A is a 69-year-old female with a history of advanced ovarian cancer. She has multiple cutaneous metastatic foci, each revealing a clinical and dermoscopic morphology similar to the one presented. The lesion in question was biopsied and was indeed a metastatic focus of ovarian cancer. The ovoid nest-like structures in this tumor probably represents a cluster of ovarian cancer cells that have become melanized due to transfer of melanin from epidermal melanocytes or due to melanocyte colonization of the tumor island. In fact, the ovoid nest seen in basal cell carcinoma reflect the same process, which consists of melanin transferred to the basal cell tumor island or due to melanocyte colonization of the basal cell tumor nest. Patient B is a 61-year-old male with a history of multiple primary melanomas and basal cell carcinomas. This lesion was a basal cell carcinoma. The pre-biopsy diagnosis is based on more than just the dermoscopic primary morphology of the lesion in question. Based on patient history, differential recognition process, and dermoscopic morphology, an accurate diagnosis can be rendered before a biopsy is performed. Let us now examine case 3 and 4. Here are two lesions on two different patients. Both lesions are located on the thigh. Lesion A has numerous dotted vessels. What is your diagnosis? Lesion B has a similar dermoscopic morphology. What is your diagnosis? The presence of dotted vessels should raise concern for the possibility of amelanotic melanoma. Lesion A is located on the thigh of a 69-year-old female. The lesion is a new growth. What is your diagnosis? Lesion B is on the thigh of a 14-year-old girl. This is also a new lesion. What is your diagnosis? It is important to be aware that any structure found in melanoma can also be seen in a Spitz nevus. The presence of dotted vessels is no exception. However, based on the age and pretest probability for melanoma, the most likely diagnosis in patient A is melanoma and in patient B is a Spitz nevus. The lesion on patient A was indeed a melanoma, and this is the pathology of that case. The lesion on patient B was a Spitz nevus, and this is the pathology of that case. The accurate clinical diagnosis of a given lesion rests on more than just the dermoscopic primary morphology of the lesion in question. It also requires knowing the pretest probability for a given diagnosis. Let us now examine case 5 and 6. Here are two red lesions. What is your diagnosis for A and B? Lesion A reveals well-defined lacunae separated by septae that have a blue-white veil-like color. The lacunae correlate with dilated vascular spaces. Lesion B has red blotches that can be mistaken for lacunae. However, some of these red structures have vessels within them, and thus they cannot be lacunae. In addition, there are no septae separating the lacunae-like structures. Lesions with lacunae-like structures that are not separated by septae should be viewed with caution. Lesion A was a classic hemangioma. Lesion B, on the other hand, was a melanoma. Melanoma on rare occasions can present with lacunae-like structures. However, on close inspection, one will often see blood vessels coursing through these red blotches, and the red blotches will not be separated by septae. Let us now examine the last two cases, 7 and 8. Lesion A and B are located on the arms. of two separate individuals. Lesion A is a new lesion on the arm of a 50-year-old man who had a 4.8 mm melanoma excised from his shoulder. What is your diagnosis? Dermoscopy reveals numerous serpentine vessels. Lesion B has a mammulated topography and is on the arm of a man in his early 20s. The lesion has been present for as long as he can remember. The lesion occasionally gets traumatized. What is your diagnosis? Dermoscopy reveals numerous serpentine vessels. Both lesions reveal serpentine vessels, which is considered to be a melanoma-specific structure. What does melanoma-specific mean? It means that the structure is more often seen in melanoma than it is in a benign lesion. It does not mean that benign lesions cannot manifest a melanoma-specific structure. This is one reason for why the malignant to benign ratio is hovering around 1 to 4 to 1 to 7 in pigmented lesion clinics. Since both lesions are raised, short-term monitoring is not an option for following these lesions. Both lesions require a biopsy based on the fact that they are raised and based on the fact that they reveal a melanoma-specific structure. Lesion A proved to be a melanoma, and lesion B proved to be an intradermal nevus. Thank you for your attention.